my name is Lexi Yoo. I'm a nurse practitioner from Yoo Direct Health in Noblesville, Indiana, and today we are going to be talking about all of our experiences here at Calm, and we get to interview Rob McKinney from Biote.
My name is Rob McKinney. I work as the head of provider training operations for Biote. We're based in Irving, Texas, and we train providers on incorporating hormone optimization into their practices.
And I'm Dr. Kris Wusterhausen. I'm a family practice doctor in Dallas-Fort Worth, and I've been with Biote for quite a while. I'm the medical director for the Irving Biote Training Clinic and all the things.
What's been really cool is that Kris and I actually get to teach together, not only for New BioAge, but also for Biote as well. And what's been really eye-opening is to see all the familiar faces that we see at Biote, also here at Calm. So, Kris, you've been with Biote a very long time. So talk us through maybe how some of the education has changed and why we're seeing more Biote faces here at the clinical application of longevity medicine.
I always like to say I've been with Biote for so long. I think I was a double-digit number when I joined. I think I was like 50-something. And so Biote was all about just training about utilization of pellets, right? And even that training has come so far in the last decade plus. I mean, and especially in the last couple of years. To now where at Biote we're actually implementing what we call advanced training, where we're actually implementing advanced hormone training along with a lot of what we do, longevity medicine, because we know that it all intermingles and goes together, right? You can't just expect to fix someone's hormones and fix them. It's so much more complicated than that. And so the good part is I think Biote is doing a great job of increasing their education presence, and I think it's only going to grow. I don't think it's going to get any less. It's only going to become more. But even despite that, there is always this thirst for more learning from most of the providers, and that's where places like Calm come in to bridge those gaps. And you know, the truth is I think you can't get your education from just one entity any longer. You have to get it from multiple entities, and I think that's what makes Calm really unique, New BioAge really unique.
Absolutely. So Rob, just as Dr. Wusterhausen talked about the education shifting, can you talk us through what that process has been for you guys and what all the feedback you take into account to make that for the practitioners?
One of the things that we've been really interested in, as Kris had kind of alluded to, is evolving the education model. And so in 2025, 52 primary certification and advanced trainings last year. One of the mandates that we had in 2025 was to reduce geographic barriers for our practitioners to engage with us in this advanced training. Previously, we had been kind of operating those in a siloed, kind of a one-day model, and our practitioners loved the education content, but one of the areas that we were consistently getting feedback for is if we did a peptides and longevity-based day, then they were wanting the clinical non-responders and the access to the additional medical faculty with, Dr. Dorr and Dr. Rice and what they were doing. And so this past year, as we all know, in November, we kind of rolled out a model for a 2-day training that married those concepts together. And so we're bringing that forward for the entire slate of our advanced trainings in 2026. So we're going to be starting with our first one next month at the Vea Resort in Newport Beach. And I know everybody here is super excited about that, as are the rest of the medical faculty members and everybody in Biote. One of the things that we're wanting to leverage is the power of Biote's network. As you mentioned, we see so many familiar faces here. There's so much energy and passion. And Biote definitely has that familial atmosphere. And so this year we're bringing more of that dedicated time for networking within that. We want the clinical education content is always of the highest quality, but we want to infuse that fun so that people have access to our medical faculty and that they've got plenty of time to mix and mingle with their peers, because that's where the magic happens. We all watched it firsthand the Friday evening of the November training that we did, and so I'm super excited about that expanding into this year.
Definitely. I'm super excited to be a part of it. I know Kris and Leonard as well. I feel like every time we do it, we just get better, and we get better feedback to make the next training even more educational and more impactful for those practitioners. Kris, can you talk a little bit about, since you started specifically with hormones, and then as your hormone pellet practice grew, then you started adding in the integrative medicine, the peptides. Can you talk about what that journey looks like for a practitioner? And because it can be overwhelming. You and I both know that it can be so overwhelming. You come to these conferences and it's like, I want to do all of it, and it's like drinking from a fire hose. But talk us through the cadence of what that practitioner journey looks like and how Biote fit into that, and then where a organization like New BioAge kind of comes in.
Yeah, I mean, it can still be overwhelming, right? Even as
Every
an
day.
advanced practitioner, it can still be overwhelming because you hear so many great things and so many like, oh my gosh, Dr. Yurt does it this way, or Dr. Hussein does it this way, and those are all amazing, and I want to implement it all, and the truth is you can't implement it all. At the end of the day, you got to be you. You got to do what you're comfortable with. And if I could give any advice to practitioners out there, it's go at the pace that you're comfortable with. I think too many practitioners try to just jump in the deep end and survive, and most of the time they drowned. And so, for me, I was lucky. I literally just did hormones, and that's all we did. And I always tell the story of how you always think you're the hero because you fix everything,
Right.
and they come and they don't feel good. Maybe I
Right.
should have done a Dutch test. I was actually counting it up. I think it was over a decade ago is when I got exposed to peptides. And peptides has been that bridging of the gap for so many of these patients who, despite hormonal regulation, they still just don't feel as well as they want to. If I could give, though, the real advice I would say is, like, if you're going to go into the longevity field, is listen to your heart, listen to what feels right to you. You have to have a passion for
Right.
it, or it will not work. Like, you have a passion for the gut,
Right.
like
Right.
you
Yeah.
love the gut. And I'm trying to gain the passion for the gut because it's not easy. I can get the passion, it's just hard to understand. And you have a way of educating that makes it sound simple, but it's still complicated, right?
Exactly.
It's not easy.
can be.
And so I just would say find your passion. We have found our practitioners that we are able to ask a question that isn't going to be considered
Right.
dumb to, right? It's intimidating to walk up to Dr. Yurt and ask her a question, and you're going like, is she going to think I'm a dumb, you know what? It's good to have a group of providers that you can rely on who think like you think, who have the
Right.
same goals as you do. And I think that's what New BioAge has brought. It's what Biote brings. Rob said it, Biote has that familial feel. So does New Bio,
definitely.
and that's all I want to be part of. Like, I'm not trying to throw any shade at A4M. There's no familial feel
No.
of A4M. It's a big churning monster, right? And there's good information there, but you're just one of thousands of
Right.
practitioners.
Right.
And so, even though this is big, it's like 500 practitioners, and they still get access to all of
Right.
us. And I think that they feel comfortable. I know I've already been asked multiple questions today. I'm
Yeah.
sure you have too.
I would say one of the really unique things about Biote that I've appreciated, and I would probably be considered an expert in many different things, hormones, gut, is that they're always trying to evolve
Yes.
for the practitioner. And I can't stress that enough. And I get questions all the time like, I want to get into pellets. Do I have to go through a Biote? And I tell them, listen. The thing about a Biote company or Biote in general is that they have consents. They have they take this abstract concept
Yes.
of how do I implement this, and then what is the documentation I need? Where do I even get these pellets?
They keep you out of the weeds.
Yes.
Yes, they make it a lot more streamlined. So this way it's doable, and then once you get comfortable with it, then adding on all the fancy bells and whistles, and now we do this, and now we
Right.
do this, and now I got an in-body. I think it just makes it a lot more palatable
Yes.
for practitioners breaking into this industry, that I can do this, and this is kind of like the family that will help me do this.
I agree.
So I think that's one thing I appreciate it, especially having been with Biote 8-9 years, that I feel like they're always trying to evolve to make it for the practitioner and what are best for patient safety.
Yeah, and I think it's important as practitioners that have been with Biote for a while to realize, because I hear this complaint, is like, we're pellets and we're pellets only. It's okay for Biote to add new things
Absolutely.
under its umbrella. I've always envisioned Biote being that all-encompassing medical education entity that can teach me lots of things, not just pellets. Yes, pellets are probably always going to be Biote's
Sure.
primary focus, but there's so much more to it. And because I hear a lot of the OG providers that sometimes complain, they're like, I thought we were a pellet provider.
Yeah.
Like, well, we are, but we need to give our practitioners more knowledge than just that.
From the business perspective, I also say, well, then don't get upset when your patient retention sucks because they
Right.
wanted to go somewhere else that understands peptides,
Yes.
that does in-body, or that maybe pellets weren't a good option for them. Maybe Kaisertrex is a better option for
Right.
them. So I think, again, if you don't want to get passed up, you're going to have to evolve. And I think that's where Biote and the education come from,
Yes.
is to helping them to evolve to the next step.
You kind of mentioned it. It's designed to be a turnkey solution. You don't have to reinvent the wheel when you
Yeah.
follow Biote's processes and
Right.
structure. It's tried and true. But as you mentioned here, one of our kind of recent mottos is science is always advancing, and so is Biote. And to Kris's point, we have to challenge, we have to evolve as medicine evolves and patient demands evolve, because they're the ones that drive the conversations, and that's why you see such an interest across medical specialties and disciplines. I mean, more and more in our primary certification trainings, you're seeing primary care, you're seeing
Yeah.
family practice, you're
Yeah.
seeing internal medicine,
Right.
you're seeing cardiology,
Pain medicine.
because patients come in and they see providers that they're comfortable with, and they expect them to be knowledgeable about these subjects. And we know in medical school there isn't deep dive education about this. I talk to residents all the time at trade shows and things, and they always point out there's a huge deficiency, and that's where we're able to kind of help close the
Yeah.
gap. And then coming to Calm, you see so many kind of areas that are cutting edge, and that's what we want to be exposed to, because we know that this is the new frontier, and this is what our practitioners are going to be expecting and needing to help their patients extend their health span and their vitality, and
Right.
that's what we're passionate about.
Yeah, no, absolutely. What's really exciting, I think, too, shifting gears a little bit, is black box warning, was removed from estrogen, and then the change in the testosterone warning label. Have you seen that as an impact in Biote education, or more practitioners, or more people asking for things?
I would say the demand for our primary certification training, honestly, since December, we haven't had a space available
Yeah.
at any of our primary certification
awesome.
trainings. Kris and I have been troubleshooting how do we continue to expand to meet this demand? And so these are really good challenges that are
Good
a
problems to
byproduct
have.
of, again, the ever-changing nature of the landscape. And this has opened up huge opportunities
Sure.
for all of us.
Sure. Yeah.
The current administration, and it's funny because we're not always usually talking positive about the
Yeah.
FDA, but
Yeah.
those were things way too long coming, right?
Right,
But
right.
we're happy that they're here,
Yeah.
taking away those black box warnings, changing the wording on male testosterone. Have all been really positive impacts, because we all knew it was BS, right?
Right.
But you still can't talk certain providers into, well, there's a black box warning
Right,
on it. Well,
right.
look at the data.
Yeah.
So
Yeah.
finally, it's nice that the FDA agrees with us
Right.
on it.
Yeah.
So.
I think one thing that's really interesting, and I said this in my lecture on hormones and hormone metabolites, is testosterone's having its moment, right? And so, I know pellets can get a bad reputation. I think just like injectables, I think
Yes.
in the hands of a wrong provider, yes, they can be problematic, but so can anything. And so can you talk a little bit about where maybe you foresee testosterone options for women?
One of the things that providers want when treating patients is confidence in the dosing. I think the hesitancy that I get anecdotally from the providers we engage with is the fact that this is going to be implanted in the sub-Q. And so when it's in, it's in. And I want to make sure that I've got the dose right from jump. And
Right.
so one of the things that we provide, the clinical decision support software, proprietary algorithms that Biote has built based on millions of patient insertions over the years. You're including things like LCMS labs for all the biomarkers, family medical history, and so you're getting customized dosing recommendations. Of course, to the physicians, and I'm not one, but to the physicians, these are recommendations for quality starting points so that your patients are likely to respond extremely favorably from dose one, and then having the guidance for follow-up, how and when to pull those labs, what type of consultation to have, what does the second round of dosing look like to help mitigate patient attrition, and I think that's where when you talk about like with women and men, this really does apply, is providers just want confidence, and our systems allow for that from jump.
Right. And I think too, pairing something like that with the knowledge that you get at a place like Calm. We talked about hormone metabolites, and what's difficult is serums are great because it's quick, it's easy, it's very inexpensive, but not any two patients are the same. And so if someone's not reacting how an algorithm would fit, this is where now education level 2 comes in. It's okay, I'm going to actually figure out what metabolite or what the issue is with the hormone so we can better improve the outcome. So how would you say, Kris, that would impact specifically in the men's health side of it? Like, we can talk females because I feel like they're like a graphing calculator, and men are like a 4-function calculator. So how does that kind of correlate in what you see in your men's health?
It's been huge, and one thing I want to go back to really quick, if you don't mind, is one thing we hear a lot with providers is like, oh, I tried pellets, or I got or there's a provider once that said, every patient I get on pellets is doing horribly, right? My response to that was, well, guess what? I see a ton of people on gels and creams doing horribly. Because first of all, if they're doing great, they're not looking for a new provider, right? Yeah. They're happy.
Right.
And so it's not just about a pellet, it's about who manufactured the pellet, it's about the dose of the pellet, about how that pellet was used, it's about supplements you put with the pellet, lifestyle changes implemented, did you combine it with things like GLP-1s and other things like that. So, what you were saying I couldn't agree with more. There's a modality that is right for everyone. All modalities are necessary and useful. I happen to think pelleting is the most common used modality that I use. We've talked about Kaisertrex. Kaisertrex does play a role in my clinic. Yeah, I think there are specific patients that are right for that. What I'm seeing in the males, though, is much more young males coming into the practice. I really believe that low testosterone in men is truly an epidemic at this point. And actually, we were talking to the CEO of Kaisertrex earlier, and his stats, not mine, but he said only 3 million males are on TRT in America. That's a staggeringly low number, actually, when you think about it. 3 million males. Like, I thought that number would be huge, and because there is real talk of testosterone going non-scheduled. That is potentially on the plate. And so, that's what kind of started that, and it just was really mind-blowing to me to think that we're making this big dent in the testosterone community when it's kind of like obesity, right? Like all these GLP-1s and this prediction that more than half of the country is going to be on GLP-1s, but obesity is rising,
it's
right?
still going up.
It's still not slowing down. So,
well, this has been great, and I hope that we continue to work together with Biote and the new BioAge team, and it's so exciting to see where the education is headed for both companies, and Kris and I just get to be a part of it with all of
we get to experience both sides of the fence.
all of our collaboration and education. So thank you.
Yeah, absolutely, and thank you for having us here again this year. It's been an awesome experience, and I can't wait for day 2.
Yeah.
Thanks, everybody.